So I'm looking at an article and I just want to say this is extremely disturbing. And it's what I've always thought that they're not really being forthright and honest about the numbers of people who actually have the virus or who have contracted it. And so it says here, coronavirus update CDC says the rate of COVID cases in children steadily increasing. And so I knew this was going to happen because I will be honest with you, I have seen where schools have shut down the same week they open up because there's an outbreak as soon as the kids go into the building and start classes. So with all of the social distancing, with all of the hand sanitizer and the gloves you want, masks, that is not enough. So it says that the rate of the cases in children is increasing because you have more children that are now getting together. And I know what people are going to say. They're going to say that Jared Kushner was on the news and he was saying that him and his wife were going to go ahead and send their kids to school. That's because they have money and insurance, health insurance. And I want to reiterate that to you that there are families that don't have health insurance. They lost their jobs. And so jobs come with health insurance. And sometimes it may take you a while before you get approved for like a regular medical health insurance, and that may not cover everything. And so they're not really being honest. So this article is by John Hayworth, August 16, 2020. So it says the novel coronavirus has killed more than 768,000 people worldwide. So more than 21.3 million people across the globe have been diagnosed with this virus, COVID-19, the disease caused by the new respiratory virus, according to the data compiled by CDC or CR, Center for Systems Science and Engineering at Johns Hopkins University, rather. So the actual numbers are believed to be much higher due to the testing shortages and many unreported cases and suspicions that some national governments are hiding and downplaying the scope of their outbreaks. So the U.S. is the worst affected country in the world, with more than 5.3 million diagnosed cases and at least 169,423 deaths. And so here it shows a photo, April 30th, a postal worker who's sorting mail in LA, California facility right here. And you see how they have to be covered, and some of the jobs are like that. And I want to stop and say, if they don't have masks, gloves, hand sanitizer, then some people don't want to work at those jobs because they feel unsafe. But even having that, you're working in conditions where it's poorly ventilated, it's hot, you're working next to close to other people in proximity. UPS and some other a company, I believe FedEx, had outbreaks recently of their workers catching the virus. So it goes on to say that here's how the news is developing today, all times Eastern. Okay, so it says latest headline. So 10:45 a.m., 7 million tests conducted in New York State. Okay, New York State has conducted 7 million diagnostic tests for COVID-19 since the start of the pandemic. So that's a truck going by. Sorry about that if you can hear the noise. So Governor Andrew Cuomo said that in a press release Sunday. And so the ninth straight day, the percentage of the positive cases in the state was below 1%. So the state saw an additional 607 coronavirus cases and now has a total of 425,508 cases statewide. So Cuomo praised the hard work of the New Yorkers for the decline in the new cases, but you still have new cases. So let's make that known. There's still people getting infected. So for more than a week, we've seen our positive rate stay below 1%. And to date, New York has done 7 million tests. So these are the remarkable accomplishments the New Yorkers should be proud of, Cuomo said. So, but we must not become complacent and risk slipping backwards everyone must remember to wear a mask, social distance, wash their hands regularly, and stay New York tough. Okay, so 6 deaths were recorded in the state on Saturday, increasing the New York death toll to about 25,250, and release stated. So it goes on and on and on. So this is where it gets into the kids. So CDC has issued guidance to inform pediatric healthcare providers and said that while it is unclear whether children are susceptible to the infection by SARS-CoV-2 compared to adults and whether they can transmit the virus as effectively as adults, recent evidence suggests that children likely have the same or higher viral loads compared with adults, and that children can spread the virus effectively in households and camp settings. So the rate of cases in children in the U.S. has been steadily increasing from March to July 2020, and it's going to get more because now they're joining and going back to school and convening back to school. So the CDC updated guidelines to read. So the true incidence of SARS-CoV-2 infection in children is not known due to lack of widespread testing and the prioritization of testing for adults and those with severe illness. Hospitalizations rates in children are significantly lower than hospital rates in adults. COVID-19 suggesting that children may have less severe illness from COVID-19 compared to adults, but while children infected with the SARS-CoV-2 are less likely to develop serious illness compared to adults, children are still at risk of developing serious or severe illness and complications from COVID-19. So the statement continued. So recent COVID-19 hospitalization surveillance data shows that the rate of hospitalizations among children is low, 8.0 per 100,000 in population, compared with the adults that is 164.5 per 1,000 in population, 100,000 in population, but hospitalization rates in children are increasing. So CDC also said that while children do have lower rates of mechanical ventilation and death than adults, 1 in 3 is what they meant to say, so that's a typo. 1 in 3 who are hospitalized with COVID-19 complications in the U.S. were admitted to the intensive care unit, the same rate for adults. And so this is disturbing because a lot of people think that kids can't get sick and kids can't have the virus and they can't carry it. If they're people, they're little people, they can carry it. I hear that they can have it in their noses and in their throats. And so now that they're going back to school, it's more than likely that you will see the cases of this rise. And so if you want to see this article and you want to read the rest of it, it is John Hayworth, coronavirus updates. So what's disturbing is that they're not really, what's bothersome is that they don't really come out and tell the truth about what's going on. And so more and more people get sick when they have misinformation and they don't know what's going on and they think everything is safe. And they go into these environments thinking that it's safe because they're listening to things on the news. These are people that have money, health insurance, and they're saying they're sending their kids back to school. Some of these people are like that. And then the ones that don't have health insurance, I believe that they're listening to misinformation because they think somehow that their kids are not going to get sick. And so it says plain here that your kids can get infected, your kids can have it, your kids can get sick. And so just like adults do. And so, I mean, do you not think your kids aren't people? I mean, I just don't understand this stupidity in what people are thinking. And so it's just sad. So what I've been seeing here in South LA, I've been seeing more people speeding down the street. They're in a frenzy. They're trying to buy their food and necessities. The postal office was not doing well. Everybody relatively around in the area has to go to the post office to pick up their mail. Not all the post offices are operating well. Some might be and others aren't. It is slow, longer lines. So what I did see is there were some postal workers. They were by hand. they were hand delivering and putting mail in mail slots, because I believe there's sorting machines that were taken out. So they have on the news people saying that they're not taking out machines and they're not slowing down the mail. Well, you're not actually seeing what's going on in some neighborhoods and some communities. And so it makes it harder for people to get their mail. They have to actually go to the post office. They can't even get it. And I'll add this in there. When they were saying that they were going to send debit cards and stimulus checks, it caused people to have mail break-ins where their postal box was broke, their mailbox was broken into, or multiple mailboxes were broken into in certain neighborhoods. They don't talk about that either. And so a lot of the stuff that you're seeing on the news is like they just tell you what they want you to hear, not what's really going on. Basically, that's what's going on. Is you have a lot of mail break-ins, you have long lines at some post offices, and not mail is very slow. It's not getting to all of the residents, and things are happening. Kids can get sick. People are getting sick. People are dying. People go to work and they go to work sick, knowing they probably caught it. Some have mild cases, some more severe. I've been seeing a lot of ambulances going up and down the street, just racing up and down the street. That I've never seen that many ambulance trucks going up and down the street. It's like one or two every 2 hours that you're seeing. So that's how you know something is going on. They're not telling the truth. I believe it's a lot higher than 5 million, honestly. And so I'm saying this to you because I'm very disappointed, because when I'm on Twitter, I've been on Twitter, you have celebrities talking about, oh, I don't want to hear negativity. So that's because they have money, they have big houses, they can hide. They don't have to live in these neighborhoods and go through what real people go through in the neighborhoods. Some of them have grew up in these neighborhoods. They leave and forget what it's like. And then they get money in their pocket and their head gets big and fat. And all they're concerned about is you put money in their pocket. And that's it. They don't care about anybody else. They're just as self-centered and egotistic as 45 is. And so I'm being honest about it. And so that's what's happening. These neighborhoods are suffering, especially the ones that are vulnerable in these neighborhoods. And you know who I'm talking about. It's usually Black and Latino people. And a lot of stuff has been going on that they're not putting on the news. Crime has been going up in some of the neighborhoods because people are feeling like vulnerable. And when they know people are vulnerable, that's when you have predators out. And they try to do things, like steal from you or break into stuff. Like we had the mailbox break-ins, where, when they were announcing, oh, we're going to send stimulus checks and we're going to send debit cards in the mail. When you do that, then neighborhoods that, have are more risque, even neighborhoods that aren't risque, it's more chance of the mailboxes being broken into because people think they're going to get debit cards with money on it. People think they're going to get checks and they're going to be able to forge, fraudulently take the checks and cash them. And so a lot of stuff happens. And so direct deposit payments is probably good, but I know everybody doesn't have it where they can get direct deposit. But when you start announcing all these things, criminals are looking at that. You already have internet crime going up. And so a lot of stuff is happening that they're not putting on the news. It's very disturbing. And that's the reason why you have people that are fighting. Then there's a woman, I don't even want to say her name, but, because one time I made a video about somebody that was saying that the Floyd incident never happened. There's a woman saying that the Vegas shooting didn't happen. Then there's another woman that's out saying that she's for Trump, and she's saying that we're going to end the pandemic by not wearing masks. Although you hear that the numbers of people is over 5 million that have died. And we know this is a respiratory virus. And so it's bringing out all of the crazy people, all of the people who are delusional. And it's become a shit show. Sorry, I probably won't get I don't know for saying that, but I'm just being real here. It's just, come on now. This virus is real. People don't take it serious. You do have people that think this is a game still. They think because they can't see it, they can't feel it, they can't hear it, it's not standing in front of them, that it doesn't exist. Yet you see all these people dying. And The other thing is I don't believe that they're really giving real numbers. Some of it might be by accident because some stuff is going unreported, and some of these schools, I fear what's going to happen is just to stay open. Some people are desperate for money because we have the issue with people worried about their bills and how they're going to survive. So some people work these essential jobs, so they'll underreport things and sweep it under the rug and try to continue open, keeping these businesses open when they know there's an outbreak that is brewing. And then it'll pretty much put other people at risk for catching the disease because people are more about, the economy and more about money and keeping, which some of that isn't deliberately just being evil, but there's two fears. They're fearing that they're going to get evicted, or they're fearing that they're not going to have food to eat, they're not going to be able to pay their bills and be able to pay their mortgage. Then there's also the fear of catching the disease and not having enough money for medicine. um, Maybe holding on to the job means that you have health care. If you don't have a job now, you don't have health care, active health care. So there's a lot of fear going on, and they're not talking about this. And it's so frustrating because I feel like people are not really being honest. Some people are going through this fog of denial, and they're not being forthright. And the news people, it's I know it's not every news anchor person that is doing this. I know maybe they have to say what it is that they're supposed to be saying without getting fired. But then some people, they downplay this stuff, but it puts a lot of vulnerable people, their lives at risk. And so I think that's wrong. I honestly think it's wrong. People don't like it when I tell the truth, but the truth hurts, right? But the truth will set you free. So I'm just being honest here. And if you don't like that I'm telling the truth, then maybe this is not the channel for you. I don't sit up here and make up stories. Sometimes things are optional, opinions, but this is an emergency, a national emergency, a global emergency actually. And I feel like it's wrong to not tell the truth and get on the news and make up lies. Some every now and then you get bits and pieces of half truths, and then the rest of it is kind of like hidden and swept under the rug. They wait and they procrastinate, and then when something horrible happens, then they come out with the truth of what the rest of the truth, put it that way, not the full truth, the rest of what they should have told in the beginning. And so that's how this whole thing started, was when people didn't really know what was going on. They weren't being told the honest truth. And I believe that's the reason why we have the problems we have in this country, because people are not honest. They don't tell the truth. They want to do photo ops, and they want to, go on their fame, and they have this big head and this big ego, and they're about how they look on TV rather than people's lives. As long as they have health care, as long as they have somewhere to hide away when things get really out of control, as long as their family is safe, they could care less about anybody else. But I did hear that some things recently happened. This virus, like they say, is an equal opportunist virus, and so I did hear some things recently that happened to some people, and so I'm a little curious as to why it happened. They're not saying, and I'm not going to say any names, but we've been hearing about some folks, and they're keeping quiet on what it is that they died of or what they're sick with. And I believe some people have gotten infected with the virus and they don't want to tell. And so that's what I'm saying. But anyway, I'm gonna let this video go. What do you think? I think this is a bad idea. I was saying this from the beginning, the get-go, that kids should not be going to school. The remote learning is probably better, or smaller groups of kids, if they're grouped at all, a smaller amount of kids. But that's hard when you have so many kids that need learning. The other thing is that I know they have other creative ways that they're trying to get kids engaged in school. You do have kids with special needs, young people with special needs, and so maybe they need like outdoor tutoring, or they need some other creative style of learning. But it's very dangerous what's going on, and it's not that people don't want to teach. It's that, you got to think about the teachers. You got to think about their families, and they got kids and they got lives. They don't want to come home and bring this home to their families, because then now you don't have that great teacher to teach your kids. So I'm just saying that, a lot of misinformation is really going around out there, and it's sad because a lot of our people are dying and they're not being honest about this. And I'm very disgusted by what I see on the news sometimes when they don't tell the truth. And they know who they are, the people that are involved in that, who are hiding the numbers, who are downplaying the amount of people that are dying, that this stuff that you hear. And then they don't come to these neighborhoods. They don't live in these neighborhoods. They don't see what people's suffering is, and they don't know what's going on. The fear that's out there. Um, and I'm seeing it even in South LA. I'm seeing people that they're struggling. But anyway, I'm going to let this video go. Be safe with your families and take care. And also, I'm going to add before I go that I don't know if it was Face the Nation, but I heard something on TV where there was some kind of secret powers of authority that the president said that he can enact. And I'm paraphrasing, that he could probably, the fear is that he could probably take away suspend the constitutional rights, suspend them. Some people had a fear that he could take away people's habeas corpus. Habeas corpus is when you have your day in court. And so the fear that maybe anarchy could take place, maybe that there'll be a full-on riot when people know that they've been left to the wayside to die. And then you'll have like people desperate and clamoring around and breaking into places, and then they'll deploy troops out and then shoot people, maybe throw people in vans, take them away, put them in jails, and they don't have their day in court. So a lot could happen with the duration of this virus at the speed that it's going and people that are getting it. Well, anyway, I'm gonna let this video go. You guys keep yourself very grounded, and pay close attention and read between the lines. A lot of this stuff they're not really being honest about, going in the neighborhoods, especially the real vulnerable, poor neighborhood communities, to see what people's lives are like. And so I'm gonna let this video go. Like, comment, subscribe, and thanks for listening.